We are back here at 9:10. Spring is in the air, and so is the pollen. Many Minnesotans are feeling the signs of allergy season, some reporting more intense symptoms than usual.
Dr. Ecole Giorgio is KSTP's medical expert, here to dive into a few of today's medical headlines, including allergies, which we'll get to in a moment. First, Dr. Giorgio, you do want to have you want to point out this is kind of a public service announcement, but just in case, don't look at if you can see it, don't look at the eclipse.
That's right.
What does it
burn your retinas? And you know, your retinas don't have pain sensors, so you could be hurting your retinas and you won't feel it, but you'll recognize it later when you're having vision issues. So
what does that mean? Like you'll see it like imprinted in your vision then, or?
Well, the sunlight can burn the retina, which is the back of the eye, which is, you know, a major part of why you can see, but you won't feel any pain. So, you know, when you touch a hot stove, you feel the pain and you pull away.
Gotcha.
The back of your eye doesn't feel pain, and so you can't recognize that you're damaging it so that you could turn away. So until you realize later that you've done some damage.
Those little silly glasses protect.
That's right.
And work. All right.
Absolutely.
Let's talk about allergy season. I feel like we talk about this every year, but you were just saying there's always something new to learn about it.
Always something a little new. So allergy season is earlier, longer, and more intense.
Yuck.
Sorry for the news. And that comes from real data. So there was a good study done about a year ago that looked at pollen counts and climate, temperature in 60 different cities over 30 years. So over the last 30 years, allergy season has gone 20 days earlier, so more around Valentine's Day it's starting rather than St. Patrick's Day. It is 8 days longer, and there's 21% more pollen in the air. Now, not all areas of the country are affected equally, so Texas and the South are affected most, but the upper Midwest is second in line to who's affected most, and that includes us. So in the upper Midwest, allergy season gets, that's hard to say.
Allergy season, yeah.
Allergy season is starting about a half a day earlier every single year.
So for those of us who get them, and so those of us who suspect we get them but have never really fully come clean on it, it's itchy, watery eyes, it's the snip, like, we kind of know what the symptoms are, but what exactly is it?
Oh, this is so cool. So
it's not cool.
I love this stuff. I geek out on this stuff. So trees, grass, and other plants make pollen. And that pollen floats through the air and gets into the airways. Then when it's in your airways, you can see where we are in the middle of the screen. For people who are sensitive, it stimulates making antibodies, a special kind of antibody called IgE. Not important to know how that's different. So that IgE, when it gets stimulated, it then attracts the pollen, and it travels to these other cells in the body called mast cells. And when those receptors get filled, when the IgE hits those mast cells, it releases histamine. That's why antihistamines work.
The itchy, yeah.
Yeah.
Okay.
And then histamine is the substance in the body that causes the itchy eyes, runny nose, scratching, all of that.
So what about new ways to treat allergies? Anything out there that we should know as far as like the medications we should be taking? Is there anything new to the market?
There's not a lot new, but here's what I will say. So first of all, avoiding exposure is really important. So if you can stay inside, but who wants to stay inside
I know, it's
on a
finally
spring
warm
day?
and
But
sunny.
you can check the pollen counters that are online and they're available. The second thing is that the less sedating antihistamines, Claritin, Allegra, Zyrtec, are less sedating than something like Benadryl, because Benadryl actually can cross the blood-brain barrier and make you really drowsy. So those three that I mentioned, Claritin, Allegra, Zyrtec. Zyrtec is the most potent. They're all over the counter, but Zyrtec is the most potent, also my favorite. But maybe the biggest thing to remember is if you know you have allergies, don't wait until after you have symptoms to start taking them, because that histamine has already been released. And so when you're taking an antihistamine, it's trying to combat what is already in your system, whereas if you take it earlier, you could prevent a lot of the symptoms from even starting.
So if you know you have allergies, when is the first time that you start taking the medication to prevent from getting all of the symptoms? The first time you see a tree budding, the first time you hear a bird chirping, like how do you know when to take it?
Well,
if you take it before the symptoms start.
Well, I mean, don't be full-fledged into allergy symptoms before you start. But you can, you'll know because of the tingling and the sneezing that allergy season
so like
is starting.
first inclination of like, this isn't.
That's right.
Gotcha.
And take it regularly.
Okay.
Most people take them periodically.
You got
when
to
they have
take it every
symptoms.
day. You got to be religious
That's
about
right.
it, right?
That's
Do
right.
steam showers and things work? Like my mom used to say hot washcloth over your eyes, like that will kind of help to relieve some of the itching and the pressure that you're feeling. Do those things work?
Well, you know what? That could work in two ways. One is that pollen's in the air, so it's all over your clothes and your body and your hair. So taking a shower can get the pollen off of you.
Yeah.
But also steam can open up your sinuses, and that will help too.
Okay.
What about an allergy shot?
Allergy shots, I'm glad we're talking about that. So allergy shots are not the most common treatment for seasonal allergies because most people can manage them with the over-the-counter drugs, with inhaled steroids, which work pretty well for most people. But for individuals that don't get relief, it is totally worth seeing an allergist, talking about whether or not allergy shots work. But it is a commitment because you have to get those shots for about 3 to 5 years. You get relief within a year, but you have to take them for 3 to 5 years in order for them to have the full effect. They're especially important for people who have allergies and also have like asthma because allergies can trigger severe asthma attacks. So for somebody who is higher risk, they're the individual that might consider getting allergy shots.
Gotcha.
Anything else about allergies you want to address before we move on?
Well, I think it's really important to talk about why the season is earlier, longer, and more intense.
Yeah.
And that is that it really, the best data points to climate change. So pollen follows temperature. And so as we have warmer winters, we have earlier blooms. That's why it's starting earlier. And then we also have drier seasons, and that's why it's lasting longer. But why is it more intense? This is really interesting as well. There's more greenhouse gases in the air, carbon dioxide. Carbon dioxide stimulates plants to make more pollen. So that's why they're making it. But there's also but sexism is also a part of it. I like this part. So there's something called botanical sexism, which affects the pollen counts mostly in urban areas and in planned developments. So there's male trees and there's female trees. And in urban developments, we tend to plant male trees because they have more pollen, but they don't drop the fruits and the seeds that make the sidewalks sturdy.
Oh, interesting.
So we have more male trees in planned developments versus female trees, which drop the fruit but have less pollen. So there we go.
If you're thinking of adding a tree to your yard,
sexism.
Maybe you deal with one aspect so that you can get fewer pollens.
Makes sense.
That
There
makes
you go.
sense.
All right, measles. What's going on with that?
Oh, measles. Well, anyone that is not vaccinated, adult or child, against measles should be concerned because we're certainly having an outbreak. And what we've seen is 3 cases already in the state of Minnesota this year. There's 100 more cases in the United States over the other 17 more states. And the people that are at most risk are children under the age of 5. Half of the cases are in kids under the age of 5. 2/3 of them get hospitalized. And the reason that they are most vulnerable is that, a child doesn't routinely get immunized until they're 12 to 15 months old. Then they get that booster at age 4 to 6. So children may not even maybe intending to get vaccinated, but they're not vaccinated because they're just not old enough based on the guidelines. And then they might go on an international trip with their family. They're in a country that has measles, they pick it up, they bring it back. And it is a very contagious virus, much more contagious than something like a COVID. So one person can infect 12 to 15 other people.
Wow.
Yeah.
That's pretty scary.
It is very scary.
Okay, we're just about out of time, but we wanted to talk about meningitis too. I feel like as a mom, I'm hearing about more and more cases of this in kids.
Much more rare, let's just put that into perspective, but the CDC did put out an alert about it, and that's because we've seen so many more cases this year than we had previously, and this year we're way ahead of where we were even last year when we saw a lot of cases. So meningitis has a 10 to 15% mortality rate, so while it's rare, we're calling attention to it because you don't want to miss it. 10 to 15% mortality rate. Even if you survive it, you could have a severe disability. And the strain that's present now isn't causing classic symptoms. So classic symptoms of meningitis: headache, nausea, vomiting, stiff neck. You might get that, but the other symptoms, you don't have the headache or the stiff neck. You could just have sepsis. The bacteria that causes it could just be in your bloodstream. It causes fatigue, cold hands and feet, just severe other severe symptoms, lower blood pressure, rapid breathing. So watch out for strange symptoms like that, because even waiting a few hours with meningitis could make a very big difference.
Is meningitis primarily in teenagers?
Well, it's primarily in people that are in congregate settings, like teenagers that go into dormitories in college. So that's why there's a recommendation, sometimes a mandate from colleges, to make sure that people that are going into colleges get a booster. And then while most people only get 2 shots for meningitis during their life, if you're high risk, that booster only gives you immunity for about 5 years. And so if you're a high risk individual, whether it's HIV or other immune deficiency, then you may want to talk to your doctor about getting a booster regularly.
Okay.
Thanks.
Thanks, Dr. Giorgio.
Yeah.
Good to see you.